Hello, Dr. William Berger here from Northeast Medical Practice, a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. Today I wanted to talk to you just briefly about different types of diet. Now, in general, I'm somewhat agnostic about which type of diet one of my patients elects to eat. However, there is really a preponderance of data in support of incorporating as much whole food, plant type foods into the diet and restricting meat as well as dairy and eggs. One of the reasons for this is a compound, a hormone called IGF-1, insulin-like growth factor 1. IGF-1 is used to help us grow when we're young, but as we get older and we don't want our cells to proliferate so much, having IGF-1 levels that are high can essentially increase one's risk for cancer. And one of the ways to tamp down IGF-1 is through a whole food plant-based diet. Animal protein does seem, according to the literature, to boost IGF-1 levels, which may explain the decreased risk for cancer that we generally see in studies for whole food plant-based diets as compared with diets that include animal products. But it's not an all or one phenomenon, or it doesn't need to be a one or the other type of diet for an individual. Of course, some people are simply not open to the idea of being vegan and so forth. They'd like to incorporate some animal products, some meat, some dairy, some eggs into their diet. So it becomes about ratios, about control, about trying to minimize or decrease the amount of animal products in the diet. Frankly, this is something that I try to do, but I am by no means, at least in this point in time, a vegetarian or vegan person. So, but I try to be mindful. I try to focus more on increasing fish and decreasing poultry and red meat in the diet. Saturated fat also seems to be a trigger for increasing cancer risk in general, and IGF-1 possibly in particular. So the types of animal products that are higher in saturated fat are red meat, poultry, as well as full-fat dairy. So to be mindful of the animal protein sources, mindful of how much saturated fat might be in them. And basically that kind of leads us toward at least a Mediterranean style diet where fish is maximized several times a week if possible, and especially cold water fish like salmon that have omega-3 fatty acids or fish oil, because that is one type of lipid that is known to be beneficial for our cardiovascular health, of course. And also high fiber diet can be helpful to counteract the effects of saturated fat in the diet. So consider having whole grains if you're going to have that hamburger, for example, or steak. So just some general pointers. Again, I'm not one of the folks who's kind of a zealot for one diet or another. There's so much chatter out there with people really being overly supportive of one diet or another without considering the possible benefits of other diets, or the fact that some people just aren't willing to choose one diet in particular over another because culturally or their own lifestyle or they're just their own palate, they're not willing to do that. They're willing to analyze them and calculate a risk-benefit ratio in their mind between quality of life and what they'd like to eat and how long they'd like to live and how healthy they'd like to be during that period of time. This is, of course, a constant thing that we all do. We know a lot of the things that are good for us. We know a lot of the things that are bad for us. Do we want to treat ourselves now and then with something that might not be the healthiest? Maybe. It's an individual decision, but it should be an informed and educated decision, which is the reason that I share these videos with all of you. So if you'd like to learn more about how we address lifestyle to optimize longevity, not just for length of life, but also health span, being healthy for most of that life, please give our office a call. We are Northeast Medical Practice, 516-604-3418. Online at northeastmedicalpractice.com, on all the social media outlets, and also our Longevity MD podcast on Spotify, where I discuss these topics in further detail and also interview other physicians and clinicians with regard to important topics in optimizing one's health with regard to metabolic factors and so forth, but also in terms of cancer screening. So until we see each other again, be in good health.